Okay, we are very visual people. We like to see. So what am I showing here? These are breast cancer cells on my left, and on the right are normal breast cells. So if you look at the normal breast cells, they look like small babies sleeping, right? Really restful and really nice. So you know they're normal. But when you look at the cancer cell, it's like it's sending out these big dendrites out of it and cellular structures out of it, seeking help. It's reaching out. When I do my sessions with the cancer survivors, I show them this picture. Because giving a face to the cell that is in their body is very important. We know how important visualization is. So if they can visualize their cancer cells in their body, they can actually send it a lot of healing. We do a lot of cellular healing. And that is where I use this. And these are actual photographs from cells under the electron microscope. Okay, so the metaphor that I use for the clients is that imagine that our body is this fish bowl, okay, with lots of goldfish, and the mutated fish are the cancer cells. So this is the fish bowl which has got dirty water. Of course, I couldn't find a bowl with dirty water. There is one on the next slide. I didn't want to repeat it. So the bowl with the water that's gone dirty, and the fish in it, of course, will die, right? So the mutated fish or the fish which are dying are like these cancer cells which are undergoing mutation in this big body of ours which has gone toxic. And what is this environment? So in traditional cancer treatment, what are we trying to do? We are providing chemotherapy, which is, what we are trying to do is, we are trying to remove that mutating fish or the fish that has gone dead out of that bowl. So when we give chemotherapy, we are trying to kill the cancer cells, but along with killing the cancer cells, they are also killing healthy cells. Okay? So that is like the side effect. In radiation, again, we're targeting radiation to again shoot down these cancer cells, targeted radiation. And in surgery, again, we're just chopping off that part and removing it. Yeah? But what's happening is, we're doing all of that, we're removing the fish, but the bowl with the dirty water remains the same. We're doing nothing to address that. We're not even telling the client that, listen, your body has gone toxic. You need to change something there. So traditional cancer treatment, which is the allopathic stream, only looks at removing the fish and throwing it out. And then we say, le bhai, tera cancer nikal liya. And at the most, I can give you survival rate maybe based on the different cancers and what our textbook says. Breast cancer, ठीक है 5 साल, you will live for 5 years, वापस आ सकता है, दूसरा breast, all that. We really want to be very very clear and want to be very politically correct. So that is this whole thing about the fish bowl. And what we do is, we think that by removing the fish or removing the cancer cells and then giving a boost to our immunity, we are somehow trying to build in better cells, yes, but our fish bowl hasn't changed, it's still dirty. So what happens to the environment? What do we do? So what I then bring to the table for the clients is that I tell them how to change your environment. And that is very important, and that is the missing information, that is the missing link between what the doctor actually treats the patient with. Now this is again another electron micrograph picture. Again, these are cancer cells, okay, and what you see, the red and the orange, they are T lymphocytes. They are WBCs, our white blood cells, part of our WBCs. And if you see them, they are all hovering around that cancer cell. What are they doing? They're catching it, they're holding it, they're trying to kill it. So our own immune system is geared to handle any kind of illness or ailment in our body. So when our whole system has gone toxic, we need to look at how we can boost our immune system, reduce the toxins from our body, tell them what is it that needs to be stopped instantly in your life. You've got to start eating a better diet, you need to move into a state where you're actually doing some kind of physical exercise So what are these complementary approaches to cancer that I use at this hospital, where I work with radiation, the patients who wait for their turn at radiation, and for the patients who are admitted in the ward for their chemotherapy. So the first thing I teach them is deep breathing, basic breathing. I mean, it's not like I know some great pranayama or anything. It's just deep breathing. Just breathe through your belly, feel the belly, and let that extra oxygen oxygenate you. Physical exercises, there is a yoga instructor who comes to the hospital, so she teaches a few basic asanas. Now when we started the work, and when I introduced this work to the group of oncologists and the oncosurgeons there, they said, wow, Evelet, you're doing something very nice, do it. But we have nothing to do with that, okay? This is your baby, you're doing it. So as of now, even in these 2 or 3 months that I've been there, it's just running as if I am running the show. It's my thing. But I know how much it's affecting and it's bringing about that change in the clients, because they look forward. I go just twice a week. I go on Mondays and Wednesdays, and they look forward and they say, Madam, I nahi us din, and all of that. So there is feedback. They say we feel better. We're doing the breathing exercise. We want to learn something more, and that's when I connect them to the different therapists that are in that area. I talk on nutrition. Oops, it's gone ahead. Sorry. Yeah. On nutrition, how again I got to know of this from Darren's book about alkalizing the body, and how during cancer the entire body gets acidic, including all kinds of acidic thoughts that we have and everything, all that we're putting in. The diet that was being given, the diet sheet that was being given to the cancer patients included all kinds of meats. It had, rice, it had wheat, everything that was acidic in nature was included in the diet sheet. And that was when I actually sat with the diet department and explained to them, what is this whole concept about acidic and alkaline diet? No idea. And our hospitals are treating. So this is where I give them that kind of information, and I tell the clients, and they're open to it. When I tell them you don't have to have sugar, and then they ask, "Kyun nahi lena hai shakkar? Why should we not have sugar?" I say, sugar? So shakkar, if you add, then that is good for your cancer cell. It will grow, and it will grow even more. So it will create more acidic environment. So they say, okay, then hum nahi lenge. So if you're guiding them in a specific way, they are ready to take that kind of advice. Yeah? Next. Because I work a lot with emotions, I also do a lot of coaching, which I do for the general public. Here, with the cancer patients, with the cancer survivors, I have noticed that, and even Louise says, there is a lot of issue with anger and resentment, which is held. Of course, it's not with every client that I come across, but there are a few who have these deep-seated issues. So I may have the cancer out of my body, I may be on an alkaline diet, I may be doing everything, but if I've not worked with at my emotional level, and I'm still holding on to some anger, some resentment, it's not going to change it. Yeah, it's going to come back. And I know this because this is what affected my mom. When my mom was diagnosed, I was this medical student, and I had my textbooks right there, and I'm checking. It's like you're doing a check mark. Okay, breastfed your children, tick. Obese, so she was not obese. She was like a slim lady, and I ticked. Okay, no, she was not obese. And something else, eating a lot of non-vegetarian food. My mother was very vegetarian. Though we are Catholics, but she would not eat a lot of non-vegetarian food. So everything got ticked off, and then I was like, what caused the cancer in her? And then I kept thinking, we knew that time about cell phone towers. She had a cell phone tower in her office building, and I said, inoculate her